Hi, everybody. Week 11. We are in week 11. So we're really starting to wind the semester down now. Let's see. This week's info, kind of for everybody, is this might be a little bit more applicable towards the first years, but for second years as well. The self-care supplies for patients. So a reminder that at Huddle, for patients who are having their first appointment, we want to gather that information at Huddle, and we want to make sure that those students have a toothbrush to start their appointment. Again, that would be at appointment 1, so that they are able to do some self-care instruction with the patient in case they need to wait for us for a check-in. So please make sure that they are getting their toothbrush. And then once you've read and approved the care plan, then you can provide the whatever other aids the patient needs. So their floss, their paste, mouth rinse, etc. So that happens after the care plan is signed. But the students asked if I would please share that with faculty this week because they haven't been getting the supplies right when they need them. And I am certainly guilty of that. Don't always remember that they need that toothbrush right in the beginning. So please prepare those supplies in advance. I will be out of the office this week, so I will not be on campus Tuesday, Wednesday, or Thursday. I will be at a site visit. However, I do want you to know if you need to get in touch with me, please do not hesitate. You can email me. If it's urgent, send me a text message. That is totally fine. I will respond to you as soon as I am able. There may be a delay depending on what part of the visit we're on, but I will get back to you as soon as I can. So you won't physically see me this week, but if you need something, I'm just a text or an email away. All right, for first year faculty, a reminder that the instrument skill evaluations are due week 12, so that is next week. So I do expect lots of those to be happening this week and next week. For the calculus detection on a patient skill evaluation, we realize there's not a great way to do that and to maintain infection control. So Jill has printed the skill evaluation form. They're in the file cabinet. The student will complete the calculus detection on paper. They'll have that ready for you in the unit, and then you will also complete it on paper. That way the student can wipe down the pens. Those can be disinfected. And then either the student or you can transfer the findings onto the iPad, or perhaps a combination. The students can transfer their findings and then you could transfer yours into the iPad on the clean side of the room. The paper should be just thrown away. There shouldn't be any identifying information on the paper. If there is on accident, just get it over to Jill and she'll get it shredded we have a confidential shredder on the first floor, so she can take care of that. For second year faculty, a couple things to be aware of. Care plans are this week, so Monday and Wednesday morning are care plans. The mannequin, we're starting to get the mannequin results in. Those are being graded. And based on what we're seeing so far, I ask you, RDH faculty, please work with the second year students on the 11-12 Explore, adapting it properly, calculus detection, and instrumentation. So want to make sure that their instruments are sharp, they're using their Gracies, and that they are able to detect and remove deposits on their patient. So please, if you have an opportunity, any extra time, please be hands-on with the students. Let them know you want to help prepare them for their board exam, which is May 7th, by working with them on some of these instrumentation techniques. This was the last week for Board's Study Club to help students. That was an optional club for students to help prepare for the national board exam. So I want to thank Nicole. She worked with me this semester on those board study clubs, but those are now completed as most students are pretty close to their exam date. that's all I have for you this week. I hope you have a really great week. As usual, if there's anything you need from us, please do not hesitate to reach out.